The latest report from the U.S. Bureau of Labor Statistics shows the number of job openings across the country has increased to 10.7 million. Now, that's a number that's been steadily rising since the nation's inflation rate. Economists say it's a unique state of economy and one that doesn't have a simple solution. Tonight, KELOLAND's Bridget Bennett takes a closer look.
In about 35 days, sometime in April 2020, 20 million people suddenly found themselves unemployed. And that sort of disruption is apparently far greater than anyone realized.
Dr. Joseph Santos is the director of the Ness School of Management and Economics at SDSU. He says the percentage of the population participating in the labor market has gone down since the pandemic.
It's not so much that there are fewer people in the labor force or employed now than there were before, but the economy has grown over time. 2020 was a while ago now, so the economy has grown, the demand for labor has grown, and the supply clearly has not kept pace.
Along with inflation, the number of open jobs is another issue the Federal Reserve is trying to address with continual interest rate hikes, the latest coming just last week.
That's a type of policy that should slow demand and slow employment and so forth, and we're just not seeing it in the case of employment.
That scarcity of workers continues to drive up the cost of labor, especially for essential roles.
Not unlike anyone else in business today, it's just tough to find workers. The problem is in healthcare, you have to have somebody there to take care of the sick people.
It's why many healthcare systems are resorting to travel or temporary staff members to help fill in the gap of missing full-time workers.
Temp staffing is very expensive. It's put a significant pressure on all of the hospitals.
But the increased cost of staffing combined with inflation.
Hospitals have seen year over year, year to date, about a 25 to 40% inflationary increase in expenses.
Has created a tight financial squeeze on healthcare systems that are unable to adjust their prices to cover the increased costs.
Those agreements that they make with insurers and with the federal government for reimbursement, those are set on a year-to-year basis. They don't change on the fly.
In tonight's Eye on KELOLAND at 10, Bridget looks at the changes some hospital systems are having to make to cut costs and stay open under these extreme financial pressures. An in-depth look at the financial sustainability of healthcare amid rising inflation. That's tonight at 10.